now we're going to move down into the long bones of the lower extremities. So making our way down from the hip bone itself, the first bone is the femur. The femur is the longest bone in the body. We've got the head of the femur. This is what articulates into the acetabulum. Again, a very similar connection that we see with the shoulder joint, that ball and socket type motion. Then we've got the neck of the femur, which is much more obvious here than it is in the humerus, right? So all of this is the neck of the femur. Then we've got the shaft of the femur. So the long connection, the rest of the bone is called the shaft. And then if we look at the outer edge, the lateral edge of the femur, we've got the greater trochanter. So the large bump or large projection on the lateral edge is called the greater trochanter. And then we've got the lesser trochanter, which is the smaller bump on the medial aspect of the bone. And so from this end, you can see them much more apparently. So we've got the greater trochanter and the lesser trochanter. And so the connection between the greater and lesser trochanter is a flat line from an anterior perspective. So it's the intertrochanteric line if we're looking at the bone anteriorly. But if we're looking at the bone posteriorly, it's slightly more concave. It's slightly more of a depression. And so here we call it the intertrochanteric crest, okay? So we've got the intertrochanteric line, the connection between both trochanters anteriorly, and then we've got the intertrochanteric crest, which is the connection between both trochanters from a posterior perspective. Going all the way down to the most distal part of the femur, we have the patella surface, which is right in between the two sides of the patella. So the middle of the patella, the femur, both sides of the femur. And so the middle of the femur is where we have the patella articulating, and we call it the patella surface. So again, just reiterating here from a posterior view, we've got the intertrochanteric crest, which is the groove or depression that connects the trochanters. We've got the condyles. And again, I talked about this in the upper extremity, but a condyle is nothing but a cartilage-lined surface where two bones articulate. And so we've got the medial condyle and the lateral condyle. Okay, and this is where the femur articulates with the tibia. Moving on now to the patella. I lost my patella there for a minute. So the patella here is the bone that's at the kneecap or the kneecap bone. We've got several parts to the patella. It has this sort of triangular shape almost. And so with that in mind, the top or the broadest or flattest part of the patella is called the base, and it's actually on top, whereas the apex or the pointy part of the patella is at the bottom. So the base is at the top and the apex is at the bottom. If we look at the articular surface, we've got the large lateral facet. This is where the patella articulates with the lateral part of the femur. And then we've got the smaller medial facet where the patella articulates with the medial aspect of the femur. So the lateral facet is larger and the medial facet is smaller. And that's going to be one way that you can differentiate whether or not you're looking at the left patella or the right patella by finding superior, inferior first, and then finding lateral, medial, and then you'll know if it's left or right. Moving right along, so we've got the tibia next, and the tibia is what's commonly called the shin bone, because a lot of the tibia is pretty much exposed under the skin. There's not a whole lot of muscle or connective tissue that's covering the anterior aspect of the shin bone, and you can palpate that on yourself, I'm sure. And so the tibia has the medial condyle and lateral condyle as well. So again, those cartilage-lined surfaces for articulation. So we've got the medial, here we go. We've got the medial condyle, the lateral condyle, and then we've got at the distal end of the tibia, we've got the medial malleolus, which is the large bulge or projection on the medial aspect of the tibia. That's the medial malleolus. And you can actually palpate this on your own ankle. So this is what you feel when you feel that ankle bone on the medial aspect of your ankle. So that's the medial malleolus. And then we've also got, I think I skipped over the tibial tuberosity, which is on the anterior aspect of the top of the tibia. So the tibial tuberosity is going to be an important attachment site for the quadricep muscles, so the large, bulky thigh muscles that run over top of the patella and insert themselves on the tibial tuberosity. This is what allows us to kick out the legs. So for example, when those bulky quadricep muscles contract and they shorten those tendons, because they're attached to the tibia, that's what gives us the kicking action that's associated with those anterior thigh muscles. And then we've got the fibula. The fibula is probably the most straightforward, least complicated bone. It's got the head, which sits under the tibia. So a really important note to make here, whereas in the elbow, we had both forearm bones articulating with the humerus, so both the radius and ulna articulate with the humerus. Here in the lower extremity, we see something different. We see that the fibula is actually underneath the tibia. And so the fibula does not come in contact with the femur at all. So all we're seeing here is the articulation between the femur and the tibia, and the fibula is not a part of the knee joint. It actually sits below the knee joint. So while there's usually a lot of similarities between the upper extremities and the lower extremities, this is one crucial difference that we don't see. And then the more distal part of the fibula, we've got another lateral rounded projection, which is called the lateral malleolus. And so we can see here, when you palpate your ankle, you palpate those two large bones. On the lateral aspect, you're palpating the lateral malleolus of the fibula. On the medial aspect, you're palpating the medial malleolus of the tibia. And those are those two bumps that you can probably feel on either side of your ankle. Finally, we've got the tarsals here. So very similar to the carpal bones and the phalanges and the metacarpals in the upper extremity in the hand. We've got a similar framework happening with the foot as well. So we've got the tarsals, which are the ankle bones leading down into the foot. And the first one is the talus. So the talus is the bone that sits on top, the talus. Anterior to the talus, we have the navicular. And the navicular is usually referred to, it's actually named because of its shape. It has this ship-like shape where it looks like a ship on a sea. And so that's why it got that name, the navicular. Anterior to the navicular, we have the cuneiforms, and they're actually a group of bones. So there's the medial, the intermediate, and the lateral cuneiform. And then lateral to the lateral cuneiform is the cuboid. And the cuboid, as we can see, is much more of a block-like, cube-like shape, hence the term cuboid. Now, underneath the talus, the large heel bone is called the calcaneus. And this is what you're actually standing on, specifically when you're standing on your heels. This is the bulk of the heel bone that sits underneath the talus itself. So we've got the calcaneus, the talus, the navicular, the medial, intermediate, and lateral cuneiform, the cuboid. And then distal to the tarsals, we've got the metatarsals. So again, very similar to what we saw in the hand. So these are the long bones that form the flat part of the foot. And then the very distal part of the foot are phalanges. Once again, here we've got the proximal row of phalanges. We don't have an intermediate phalange in the great toe or in the first toe. So we've got 4 intermediate phalanges, and then we've got 5 distal phalanges, just like what we saw in the hand. I also want to point out here, in terms of exam purposes and quiz purposes, you also want to be mindful about the order of the digits. So if I'm asking you to identify a digit, the first digit is going to be the more medial digit, also called the great toe. The second digit will be the second toe, the third digit will be the third toe, and so on. The same thing applies for the upper extremity or the hands, where the first upper extremity or the first hand digit is the thumb, the second digit, third digit, and so on. So just be mindful of the order of how the digits are numbered in terms of being able to put that accurately on an exam or a quiz. And that's all for this week.